Okay, so we finished up our history, and now it's time to move into, we're going to just base this case on functional assessments. But the one thing I want you to do on yourself right now, Emily, is you can do this seated or standing. Can you press with your fingers and give it a moderate amount of pressure? So I would say about 75% of what your max could be pushing into yourself. Can you push into those areas and tell me if it's tender to your touch?
I can't recreate symptoms now.
Okay, so you don't feel any sensitivity or anything to the touch just like that?
No.
Beautiful. All right, so go ahead and stand up. We're going to do just kind of a general movement assessment, and just let me know if you have any confusion on the way that I'm having you do the assessments. We'll do it from two views so that our home viewers can see it well. So just as you're standing right there, let's go feet together.
Okay.
Good, and then bend forward and touch your toes. Okay, back up. Now can you turn to the, whichever side, to the window, whatever you want to do. And feet together again, bend forward and touch your toes. Hang out there for a second, relax your head. Good. And then come back up. We're gonna do one more time from the side, please. Okay, and back up. And then let's go one more time facing directly to the camera. Feet together. Back up. And one more time, actually, I lied the last time. Okay, I'm gonna switch the view here so that I'm not on it. Hold on a second. There we go. This will probably be a better view for people. Yep, do the hair flip. It's gonna get in the way.
Yep.
I'm gonna try not to spend too much of our time with me writing my notes because I can always watch these again since we're recording it. Let's go just right here, arms up overhead, feet together for all of these. And then I want you to lean back as far as you can. Okay, and back up. And this time I want you to turn to the window to do it again, please. And go ahead and lean. And come back up. Just a real quick note on all of the assessments that we're about to do. You can rest your hands for a second. Everything that we're going to do, I want to know if it, number one, does this create the pain that we discussed during the history? And then any other discomfort, things to even include is if it just feels weird to you, like if it just doesn't feel good, it doesn't have to be painful, all right? But the other thing I want you to take a look at while we go through these is if you notice a difference in your body from one side to the other. So if when you extend, like one side feels stiff and the other side doesn't, let me know that stuff, okay?
Okay.
All right, let's go back towards the window again and we're gonna do extension one more time. So arms up overhead and extend back. Great, and come back up. Dr. Moore's calling me. I'm gonna have to call him back. All right, so let's go, we're gonna do rotation now. So what I would like for you to do is you're gonna do this one facing away, and I'm only using words anyways. So hands to your sides, palms facing forward, please. And then I want you to turn your head, and then you're gonna rotate with your whole body, and you're gonna try to look all the way to the opposite side of the room, turning your head. Yep, all the way to that back corner, good. And then back. And we're gonna do two more on that side. Okay, again, please. And then other way. And repeat it, go back. Okay. And then did you feel any difference from side to side on that one?
Left rotation was a lot easier.
Felt easier to you. Can you, is there any, and you can repeat it if you want, but is there a way that you would describe the going to the right?
The left felt fluid, but the right, it feels like it locks in probably the lumbars. It begins to lock in the muscles, so it just kind of stops.
You feel like it's a muscle lock coming from the low back?
Yeah.
Okay. Let's go, you're gonna stand just right where you are. And then we're gonna do a single leg balance. So actually, you can step your feet to a comfortable distance. What I'd like you to just march in place for a second, just kind of get yourself into like a normal stance and then relax. And then shift your weight into one leg and lift the other one up off the ground and hold. For the purposes of videoing, can you angle your right foot to the side a little bit? There we go. That's it. That's great. Okay, we're gonna go to the other side. Same thing, if you could kick your, yeah, there we go. I know it's like changes the test, but I also can't see your other side. Okay, relax. We're gonna do the same thing this time, but let me walk you through it first before you do it. You're gonna lift your leg up, you're gonna find a spot on the wall to think about, and then you're gonna close your eyes. Wait for me. Go back down. You're gonna find a spot on the wall, and then I want you to close your eyes. Here's the story. There's no one there to catch you if you fall, so don't be a hero. If you feel like you're gonna fall, catch yourself. Got it?
Okay.
All right, let's do it.
Okay.
All right, let's go to the other side. And back down. Do you feel any difference side to side there?
Yeah, it feels like when I'm on my right foot, it caves in as I'm trying to balance.
So difficulty level different or the same on both sides?
It felt relatively the same. It just felt like my compensatory motion was to cave in to catch my balance.
Okay. So you felt like that side was like working harder to compensate, but if to you the effort was similar.
Yeah.
Got it. Okay. We're going to move into a squat assessment. So what I want you to do is I want you to bring feet happy distance apart. So just get into a little bit wider stance, a little bit wider. Okay. No, actually go back to where you were. So you're happy. Let's do that first. Your happy stance. I'm not telling you how you feel. Let's go. I want you to bring your thumbs to your shoulders, to the front of your shoulders, like biceps tendon, right there. Perfect. Arms up overhead. Okay. And then I want you to sit back and down into a squat. And back up. Are you going to hit the table or are you far enough away? Take a half step forward. There we go. And that's you're in a great view there. I can still see everything we need to see. Okay, go ahead and squat down again. Okay, and back up. And again. And back up. Is there any discomfort when you do this?
No.
Okay, let's turn to the side. So let's go face the window. Yep, perfect. And let's see it again. Okay, up. And back down. And back up. And one more time. Can you go any lower?
So I guess I have multiple issues. I have twisted my left ankle quite a few times, so my dorsiflexion is sort of limited.
Okay. So when I ask you to go lower, let's go back into the position. And what I actually want to see this from the side. So when you're going to walk me through how this feels to you. So when you get to your like happy ending, like the happy stop point, tell me what stops you. Okay, so go ahead and go. Okay, what's stopping you from going lower right here?
So if I pick up my ankle off the ground, I can go lower, but with this ankle on the ground, it doesn't move.
Okay, so that's like a hard stop, or is it a pain stop?
No pain, just doesn't move.
Okay, so the next question, which you kind of already answered, but let's see it again. Go ahead and go into your squat, get as low as you can go. And then I want you at all costs, besides pain, obviously, get lower. So no matter what you have to do to get lower, I just want to see how it looks. Okay, and that's as low as we're going to go in a squat.
Yes.
Okay. All right, coming up. That's very helpful. Do you guys have 3 textbooks that you can stack on each other and then stand on?
Yeah. Do we need 3 if they're like thick textbooks?
I want about 6 inches, so I think you could probably work with that. That's fine. We can use it. Okay, so what I actually want you to do, we'll look at it from the side and then we'll look at it from the front. So go ahead and step your right foot up on there so you're looking towards the window. Do you feel safe on those books?
Yeah.
Okay, so let's balance that. Go ahead and stand up. And then I want you to get your, no, you're only gonna stand with one foot. So get your other foot off and tap your heel down to the ground. There we go. Good. Multiple times. Good. And the other one. Okay. Let's go to the other side. And I'm gonna switch it because of the lighting. Let's get your left foot on the, stay facing that same direction, put your left foot on the books.
The left foot is on.
Sorry, my left, your right foot. All right, now let's see it. There we go, that's a better view. Good, and then switch around and do the other foot that way, if you don't mind.
As in, do it this way?
Yeah, it's a much better perspective from what I'm looking at. Good, and then now I want you to turn the books so that your knees are facing the camera. There we go, and it doesn't matter which, I guess there's only one way to do it. Just look at us. Okay, so we're gonna do the same thing. Good, other side. Sticking.
I know, sorry, Nutter's Anatomy.
Yeah. I would make a comment about the best use of it, but that's actually a phenomenal book. We should have picked less relative books, and then I could make those comments. Okay, let's move on from here. So you can kick those books out of the way. You're doing great, by the way. Awesome job. Crushing your telehealth functional assessment case study visit. So what we're gonna do now is we're gonna do a lunge assessment. So actually, if you could kick or maybe even turn to the angle so you could lunge the length of your table. I need the other view though, so I need to look straight on. There we go. So there it is, that's better. So Emily, if you could back up as far as you can without like hitting your chairs. You can come over into the middle of the screen a little bit more. So step right in between your two chairs. It's perfect. Awesome. Now what we're gonna do is, have you ever watched skiing in the Olympics? Like
Yes.
the jump skiing? Okay, so what I want you to do is I want you to lean forward without having your heels come off the floor. Yep, and then like have your hands kind of to your side. You feel that kind of like that lean that the jump skiers do?
Yeah.
Okay, what you're gonna do though is you're gonna let yourself fall. We're not going in for that one yet, Tim, good idea though. You're gonna let yourself fall forward, staying in that lunge, kind of that lean position, but you're gonna catch yourself with one of your legs, like you're in a lunge. Does that make sense? So keep the lean though, and we're not lunging like a knee to the ground type of lunge. I just want you to land, kind of stick it on that front foot.
Okay.
Got it? Let's try it. Go for it. Perfect. And back up. I really care about the landing. Keep your back leg straight. Try that. You did it almost perfectly.
Okay.
Good. And back. One more time on that side. Good. Good. Left side, right? Do I have it right? Yeah. Okay. Let's see it. And back. Good, and back.
Once more?
Yep, one more, sorry. Good. Okay, now we're gonna go to your table.
Okay.
You're gonna sit on the table, and if I could get a view of your toes. So you're gonna sit on the table, feet flat on the ground. Can I go from the side? Right there's great, that's perfect. Okay, Emily, what we're gonna do is, what I want you to do is with your right hand, so we can see, for that's really the only reason why the hand matters, is I want you to take your big toe on either side and you're just gonna pull it passively as high up as you can pull it. Okay, and what if you could move your fingertip to the edge of your toe so we can kind of get an idea of the angle. So put your hand towards your couch. So turn your, yes, perfect, thank you. That way we can see the toe. But I need your first MTP joint to stay on the floor. Is it touching still?
Now it is.
Okay, if you need to stabilize it with your other hand, go ahead. Okay, and then the other side. Same kind of hand position so we can see well. Okay, you're gonna do that same exact thing standing. So I know you're gonna be in kind of an awkward squat to do it, but I need the foot to be loaded. There we go. Same, kind of even foot loading. So keep your other foot in line if you can. There we go. Okay, first MTP still in good contact with the floor?
Yeah.
Okay, other side. Okay, and back down. Does this feel different to you from side to side?
It feels like one side is different, but honestly, I couldn't tell you which is better or worse.
Okay. When you do it again, loaded, and I want you to not move your toes at all. Active, no active movement whatsoever. Now,
Okay.
we're not going to be able to see this as well, so I want you to use your thumb as a lever. So you're going to push at the top of your first MTP joint into the floor, and you're going to pull with your first finger. So you're going to push with your thumb and pull with your first finger. There, just like that. And I want you to feel how smooth that is, and think about that in your head for a moment, and then let's go to the other side.
Oh, yeah.
And what's the difference?
This is block of cheese. This is a block of wood.
Okay, block of cheese and block of wood. Perfect. Okay. So what we're gonna do now is we're gonna actually get on the table. And so if you guys could move your table back out, or move it out. And then we're going to do a breathing assessment first. Emily, you're going to do it. And then we're going to ask for our special guest to help. So let's lay on your back, please. And feet, so scoot your hips to your feet. Put your hands around your belly. Perfect. Hands around your belly. Well, actually, no, we're gonna just go right to it. So let's reach right above your pelvis. Put your hands right there. Good spot. Now I want you to put a little pressure with your fingers into the front of your abdomen. The web of your hand is gonna be pushing into the sides of your abdomen, and then your thumbs are gonna be pushing into the back of your abdomen, okay? And you're gonna do a self-assessment of the 360-degree action of your normal breathing. So we're not taking deep breaths. This isn't yoga. I just want your normal breath. And can you can just do live, give us some live feedback.
I don't really feel it in the web of my hand. It's mainly into my fingers. A little bit into the thumb.
Okay. So mainly into where?
My fingertips.
Okay. And then kind of describe what you feel into each thumb. Are they even?
Yeah.
Okay. And
even, there's not a lot of movement, but I can feel it press when I get to the end of my breath.
okay. Now let's lift your legs up into a tabletop position.
Do I know?
No, you're good. You're right there. Just lift them up. And then I need that same self-assessment.
It's definitely all fingertips now.
Okay. All right, let's come out of that. And then if you guys wouldn't mind setting the table up so that we can get one of my former students who got to learn this assessment last trimester is going to help out. Thanks in advance, Tim.
Welcome.
Okay, so we're going to do Yanda's hip abduction. I'll walk you through it just because I want the students to understand what's going on as we go. So Emily, you're going to lay down. It's okay for us to, it's fine in the position. Actually, can you go the other direction by like maybe 5 or 6 inches? Right, there's great. So your face is not on the screen, so any grimaces need to be shared with us verbally, okay?
Okay.
In this position, you're gonna bend your bottom knee to give you just a little bit of stability there. Now your top hand needs to be off the table, so let's just lay your elbow on your side. Bring your hand kind of over draping over your belly because it's gonna be in the way right there. Perfect. Let's stack your shoulders, please. Okay, so this is not a side posture adjustment setup, right? It's a little bit different here. And then we should have a straight line between ankle, knee, hip, and shoulder. How are we looking there, Tim?
Looks good.
Okay, so the first part of this assessment is a visual assessment of how hip abduction looks. We're gonna do this on both sides. So let's have you just lift your leg up and down, moderate pace, doesn't have to be too slow, but not like as fast as you can go. So just up and down for us. Okay, so we don't have the best necessarily angle of this, so we're gonna ask our amazing assessor here, what kind of movement do we have? Is it straight up off the table? Is it coming forward? Is it coming backwards, Tim?
It's coming forward a little bit.
Okay, and we'll talk about what that means, but we're not going to talk about it in front of the patient right now because we don't want it to change the assessment. So what I want you to do now is I'd like for you to neutralize the hip and then bring her into abduction. Good. So you're gonna maybe just a little bit higher, right about there. Great, now stand behind her. Scoot over towards the other way a little bit more. There we go, yep, exactly. So get her kind of set up, and then what you can do is you can block with your right hand. You can block either SI or like low back just to make sure that she maintains that neutral hip position. And then we'll bring your hand to the mid thigh on top, and we're gonna press. Yep, so yeah, go ahead and resist her there. I need more, lots more pressure. There it is. Yes, okay. And I want So I want you to kind of have that assessment in your head, Tim, of how that felt, okay? So we'll compare it when we flip to the other side. So Emily, just switch over. You can have your feet over the headpiece of your table for a second. So just kind of flip. And we're gonna do the same thing on the other side.
Okay, bend this leg, no leg. Here.
Good. Now, how much pressure did you just push compared to the last time?
About the same. I could probably do more.
And check in with the patient to make sure you're pushing the same too. That's one thing I always like to do is that, am I pushing with the same amount of pressure as I did on the other side?
Did that feel the same?
Yes. I don't think it was as much as the other side.
Yeah.
Okay. All right, so we have our finding there. Okay, Tim, you did a phenomenal job. Thank you for being my extended hands. Let's get the table out of the way. And Emily, we're gonna do 2 interventions today.
Okay.
So Tim, if you wouldn't mind, there it is, beautiful. Let's go, yeah, you're gonna end up being on the floor for these. So here's what's going on from my perspective. Again, I'm not there to be able to tell you exactly what's going on because I can't feel it. I can't do my orthopedic assessments. But given the information that you shared and given what we just saw in this functional assessment, what I think is going on is at some level, we are not appropriately loading your body through the lower extremity on the right, which you probably could have told me. You're like, okay, it's been an hour and that's what I've learned. Okay. But along through our assessments, what I saw consistently is we are having a lack of control coming, it could be coming from the foot and it could be coming from the hip. But either way, what we're gonna do is we're gonna see if the way that we can help your body facilitate firing can change your pain patterns. Okay, so the good news is there's stuff that we can address. The not so good news is that we have no idea that if addressing these things, it will make a change, right? So I just have to ask real quick before we get into this last piece, is there any movement or kind of body movement you could do that would create some semblance of your discomfort right now?
So there was one thing in yoga, I can't remember, I think it's called the Malasana squat.
Malasana, yeah. Yeah,
but
it's a deep squat.
Here, and if I stay here for a while, then it kind of starts to bother the knee a little bit.
Okay. That position isn't necessarily one that you get into a lot each day, is it? Okay.
No,
But that's actually really helpful information because we do need